To bring it all home, I want to introduce Brent and Kathy Rigby. Kathy's a member of the Alzheimer Association's early stage advisory group, and we're really happy to have her share her story as a patient and Brent's as a caregiver. So welcome.
Spencer W. Kimball once said, "The most important word in the dictionary could be the word remember." There are so many valuable things to remember. I want to remember who I am, Kathy Rigby. I want to always remember my sweetheart Brent, who has been my husband for 50 years. Our 6 children, Craig, Heather, Todd, Kimberly, Melissa, and Denise. Their spouses, our 22 grandchildren, and our 1 great-grandchild. I want to remember yesterday, today, and the life I have been living. I agree that the most important word could be the word remember. I have learned that Alzheimer's disease is able to rob us of being able to remember. I never knew anyone with Alzheimer's until my husband's sister-in-law, Angela, was diagnosed. She was a great person. She loved and cared for her husband and 3 children. She was kind and caring. I loved her. She was a great example to me in every way. At 57, she was diagnosed with Alzheimer's. I don't know how long her family had noticed the changes in her, but Alzheimer's takes away the person we used to know. The Angela we knew was replaced with someone we did not know, and someone who did not know us. Angela died at 63 years old from Alzheimer's. In 2022, I started to notice changes in myself. I started to recognize that I was, different. I noticed 3 symptoms. I would get anxious for no reason. Brent would ask me, as I was on the verge of tears, "What's wrong?" My answer, "I don't know." Next, I also started stuttering. I could not get words from my brain to my mouth. At times, I just thought talking was just so difficult. Then if anyone would interrupt me in conversation, I could not return to that thought. It was gone forever, as if the thought had been sucked out of my head. Because of these symptoms, Brent encouraged me to see our family doctor, Dr. Camagliano. After hearing my concerns, I was referred to a neurologist. The neurologist conducted a cognitive test, and I had an MRI that showed no brain damage. He said I was okay, but referred me to a clinical trial study that was done at Charter Research. At the time, I was in good health and not taking any medication. I exercised daily, ate pretty healthy. I don't smoke and I don't drink alcohol. In fact, it was my healthy lifestyle that allowed me to later be accepted in the clinical trial study for donanemab. At Charter Research, I was given a brief interview. I had a PET scan, MRI, and blood work was done. In July of 2023, it was official. I was accepted into the clinical trial study. I met with Dr. Miller, and I can recall that first meeting well. I said to him, "No one has said the A word yet, but do I have Alzheimer's?" And he tenderly said, "Yes, you do." It was like a slap in the face and a punch in the gut. I couldn't believe it. I've always been healthy to the point of being prideful. To say the least, this was a very humbling moment for me. It was explained to me that amyloid plaque on my brain had been building up, and it destroys brain tissues and areas concerned with memory and other cognitive functions. The hope was that the medication that I would be receiving in this clinical trial would remove the plaque, but sometimes as the plaque comes off, it causes brain bleeds, much like a scab coming off a wound causes small to large amounts of bleeding. After hearing this, I was still in. I chose this method, this offer of help to me, rather than just having myself wither away to never be Kathy Rigby again. In July of 2023, I started receiving the effusions every 2 weeks. Initially, I was there for 2 to 3 hours, gradually went down to every 4 weeks that I was there. After 6 months of treatment, I was told that the treatment did its job and removed the plaque off of my brain to a satisfactory level. Fortunately, I had no ill side effects from this medication. I came to my appointments feeling well and always left feeling well. I am now better than before. My anxiety has greatly lessened. I no longer stutter. I can now be interrupted and continue to that conversation. The drug donanemab, now renamed Kisunla, has been FDA approved. I was asked to tell my story to the FDA panel hearing for this approval. I remember that it was a unanimous decision to recommend approval at the end of that hearing. 3 weeks later, it was officially approved by the FDA for Kisunla to be prescribed to those diagnosed with Alzheimer's disease. And this means hope is on the horizon for others like me. I will be forever grateful for the help that I had received from those that were not only in the clinical trial study, but all of those I have met along the way. Since June 2024, I have been a member of the Alzheimer's Association National Early Stage Advisory Group. This consists of people living with dementia in early stages who elevate their voice to increase concern and awareness, enhance care and support, advance public policy, and accelerate research. The Alzheimer's Association is a great network and resource to get plugged into. Their 24/7 helpline is available 365 days a year, free of charge, offering confidential support and information to people living with dementia, their caregivers, their families, and the public. They also have a local support group near everybody, the individuals facing dementia, at alz.org. Just put in your zip code and find your local chapter to access information on local support groups, plus on-demand caregiver classes, as well as in-person programs and events. D. Todd Christofferson said, "We should not be afraid that the trials and challenges we inevitably will face in our lives will prevent or destroy our joy." I think that in order to feel joy, we have to have hope. When you make an effort to bring joy to someone's life, you are giving them hope. Without hope, we are lost. We have no direction. Without hope, we may just give up. Is there hope out there? Yes. Every day there are changes in the advancement of cures for Alzheimer's and other forms of dementia. A friend of mine and fellow National Early Stage Advisor, Dr. Brent Beasley, said his hope is that someday when his infant grandson grows up, he will never have to know how to spell or even know the word Alzheimer's, because this disease will be gone forever. To all of you who are caregivers, thank you. I look back at all of this and wonder if I could have done this on my own. I can honestly say that without the help of my husband, Brent, and his strong encouragement, I may have been going down a lost path. Brent has been with me every step of the way. Thank you, Brent. And thanks to all of you who commit to being on this journey with us. Thank you.
My name's Brent Rigby. I get to be with her. It's a special time. We met in high school, and she followed me home from work one night. We started dating shortly thereafter and married 3 years later. She reminds me constantly, "You're happily married and don't forget it." I am happily married. She is a privilege to be with. She's a very sweet person. My brother's wife, Angela, passed away from Alzheimer's at the age of 63. There were not any options available at that time to help fight the dreadful disease, and she slowly dwindled away. My brother had access to just about every resource available, financially, corporate ties, everything, but there's just nothing that could be done for her. 4 years later, I started seeing things in Kathy. We'd be driving down the freeway, and she'd be talking, and we were driving by something very quickly. "Oh, look at that," because I knew she'd want to see it. She'd look at it, and then say, "What were we talking about?" Then another time, we loved to ride our bikes by the beach. There's one particular beach that we just loved to ride by, and we were riding by that beach. In fact, it's the beach where we were engaged at. So she knew it well, very, that probably hundreds of times we've ridden along there. She fell behind me along the boardwalk on her bicycle, so I stopped and waited for her. When she caught up, there were tears in her eyes, and she said, "I didn't know where you were." At that point, we knew something was wrong. Like she said, her doctor referred her to a clinical research study for donanemab. They performed blood tests, MRI, and PET scans. When we were told that she had Alzheimer's, our minds immediately went through the process we watch of Angela going through her journey of Alzheimer's till it ended her life. After 6 months of infusions, we were told the treatment had reached its goal. Infusions were stopped. Just a little bit before it was stopped, we were in a doctor's appointment. Kathy went through a period where falling became part of her life. We spent a lot of time with the orthopedist. We were in the office one day. He came into the room where we were, and he interrupted our conversation, obviously, to start speaking to us about her situation. And he said, "Let me check on something. I'll be right back." And as soon as he left the room, Kathy went back to the conversation. I was amazed. I said, "Kathy, this is working." We recently learned that 95% of the amyloid plaque was removed off of her brain through this clinical trial study. Although the progression of the disease has stopped, the damage to her brain is still there. So there's still effects. There always will be effects. Though the plaque is returning, it's returning at a very slow level. Our hope is it'll be many years before she will need any further treatment. We came to love these people at the Clinical Research Center. And I mean love them. We knew they cared. It wasn't just their job. In fact, Kathy and I have talked, they must have had to do some type of personality test to find people that just cared so much. We asked the doctor, "So what happens?" Because he told us it'll return, the plaque will return. I said, "What happens?" He said, "Simply, by then, there'll probably just be a pill you'll take." There are so many research studies being done right now. We were so grateful. We were excited. We thought, what can we do to help bring this great blessing and privilege to more people? About that time, she got a phone call and told her The FDA advisory panel will be meeting soon to listen to presentations about donanemab and make a decision if they should refer to the FDA panel to do approval of donanemab. We were excited. We wanted any way we could to help other people have the same blessing. We got to listen to the whole day of presentations. And one thing we listened to, we've heard so many people talk. So many of our friends, we tell them about donanemab. They say, oh, brain bleed. I have several friends who are doctors. Oh, we avoid that because of brain bleed. If you hear that, do some more research. We got to listen to the full day of presentations. And they talked, there were about 800 patients, I believe, that partook in that clinical trial. There were 2 people that maybe had very severe effects to the brain bleed. Maybe 2 people. And the MRIs were done on a regular basis of Kathy. And people in the study, there were some brain bleeds, so they removed them. No effects, no problem. Please don't let rumors scare you away. Do your own research. Like Kathy said, we were excited. We expected to be 6 months before we'd hear about the FDA panel's decision, or FDA decision on donanemab. But we heard 3 weeks later just in the news, and what excitement it was to us, especially after watching my brother's wife go through that. After her experience in the clinical trial, we welcome the experience in any kind of clinical trial we can again. She's now waiting to see if she can get on a tau, a clinical trial about tau. She also just participated in a follow-up clinical trial for those that had taken donanemab. We're excited to be able to help share that information with researchers, knowing that that will be helpful for them. We talked to friends, we talked to acquaintances. We encouraged them, please get involved. Just last week we were at church talking to a friend, and she was talking about her mother who has some signs of not remembering things. We said, please get her into the neurologist. Please check on clinical trial studies. And she had no clue. I was grateful to hear that there was hope. During Angela's journey, she got to the point where she didn't remember her children, her grandchildren. But she always remembered her brother, her husband, my brother, Daryl. And what she would say to me is, Daryl takes such good care of me. That helped me learn that as Kathy's caregiver, I now had the responsibility to do the best I could to take care of her. My responsibility to make sure she has the best medical care she can have. We had an experience with her neurologist. We realized he definitely was not the right person to be dealing with the issues for her right now. His knowledge just wasn't there. So we reached out to get some suggestions from people that who's a good neurologist for her to see. We given some names and made some phone calls. We had no phone calls back. That was discouraging. We thought, wow. And the person referring was pretty high level and pretty well recognized. We thought, this will work. It didn't. So what I did was I typed up a letter explaining why Kathy would be a good patient for them. Hand-delivered it to a few different neurologists. And we did get response back from that. And now have been able to set up a good relationship with a new neurologist. Our journey through Alzheimer's has been much different than most people we talk to. She got in the clinical trial study very early. Her stages were early. Her treatment was early. We've learned how important it is to get fast, early diagnostics and fast, early treatment. That is not easy to do. Although there is now an FDA-approved blood test that can detect Alzheimer's at an early stage, even before we see symptoms, there are 2 different FDA-approved drugs that stop the progression of the disease. There is much more work to be done. A couple of weeks ago, because of her involvement with the Alzheimer's Association, we were able to be in Washington, D.C. for the Alzheimer's Association AIM Advocacy Forum. What a great experience. But there we ran into many of our friends that we knew from the Alzheimer's Association that are suffering from Alzheimer's. They're not able to get these drugs. They know them, they want them, but their access to drugs are blocked for different reasons. At the forum, we learned there are 3 different bills in Congress being considered right now to provide further support and research for Alzheimer's. We also learned that there's one state that has enacted laws that require insurance companies to provide these new drugs that have been provided by FDA. Our assignment was to go meet with different congressmen that day. That was intimidating. I thought, this is not going to go well. The first congressman we met with, first of all, we were meeting with an assistant. Okay, that's what I thought. We'll get the assistant, kind of get brushed off. So we're in this little cubicle talking to the assistant. When the congressman walked in, he said, "Give me a few minutes, I'll bring you back to my office." We went back to his office, heard him tell the story of how his father died of Alzheimer's. He listened to Kathy tell her story, how she had the early diagnostic, the early treatment, how she's doing so well. He looked over at his assistant and said, "We will co-sponsor all 3 of those bills. Write that down, please." What a great meeting. So we went to the next congressman's office. The start of the meeting was even a little bit worse than the start of that meeting. We didn't get to meet in the cubicle. His assistant said, "Come out in the hall and we'll meet with you." So we were in the hall, and I thought, well, this is kind of what I expected. And so she's talking to us, and she enjoyed hearing Kathy's story, but a few minutes into the meeting, the congressman's door opened. I saw a few men walk out of his office, and the congressman walked out. And he said, "I am very busy. I have a meeting with the Speaker of the House that I have to hurry and get to. Let's walk." So we walked with him in the halls that go from the Congress office buildings underground to the Capitol. He was intent listening. As we got to the halls where it split out to go right to the Capitol, he listened to Kathy as she told her story, how this early diagnostic, early treatment helped her so much. He stepped forward to her. He hugged her. He thanked her and said, "I'm on board." We need to do more. We need to talk to everyone we can, get all the support that we can. Each of us need to make sure we can do all we can to preserve the lives and dignity of our loved ones. As caregivers, our primary task is to make sure our loved ones' immediate needs are addressed, that they are comfortable whatever stage they are at in their journey. Kathy is everything to me. It is a privilege to be her caregiver through her Alzheimer's journey. I hope that I can be the best caregiver to her that I can be. So one day she will also say, "Brent takes such good care of me." I hope each of us leave this meeting today with the determination to do all that we can to make sure all is done for every Alzheimer's patient and everyone affected by any type of dementia. We can do it, and we will do it. Thank you.